Tooth extraction. Pre- and post-operative instructions. Before surgery. Pick up prescriptions from the pharmacy. If you are prescribed antibiotics, please take your first dose the night before your surgery. Take your second dose the next morning with a small sip of water. Nothing to eat or drink after midnight if using IV sedation. Brush your teeth before you come to the office. Wear clothing that is loose-fitting, comfortable, and with short sleeves. Please leave all valuables at home. Remove fingernail polish. If using general anesthesia, you will not be able to drive yourself home. You must have a responsible adult accompany you to the appointment, even if you take a taxi. This person will need to listen to your post-procedure instructions and take you home after the procedure. You will need someone to be with you for 24 hours after surgery. When you come to the office, please, for your own safety, do not have anything to eat or drink for 8 hours prior to your surgery if using general anesthesia. It is critical that you have an empty stomach for the procedure, so please comply with this requirement. This includes gum, lifesavers, and water. Failure to comply with this request will result in having to reschedule your surgery. Patients who take medications daily may take them as scheduled with the smallest sip of water possible to swallow them. Please be on time. Please arrive 15 minutes early to your appointment to get checked in and fill out any necessary paperwork that may need to be completed. Keep in mind, a previous surgery may run overtime. Be assured that when your surgery takes place, we will give you our complete attention. Plan on resting the entire day after surgery. All payments are due prior to surgery. If you have made other arrangements prior to surgery, please be prepared to pay the amounts agreed upon. Anesthesia, hospital, or surgical center patients must make separate financial arrangements with those facilities for amounts due them. Our office accepts the following forms of payment: cash, check, cashier's check, Visa, MasterCard, Discover, American Express, and Care Credit. Please review all pre-surgical and post-operative instructions as well as all prescription and non-prescription medications with the doctor prior to surgery as needed. Please be aware that use of cameras or recording devices is strictly prohibited within our facility. After tooth extraction. The removal of teeth is a surgical procedure. Post-operative care is very important. Unnecessary discomfort and the complications of infection and swelling can be minimized if these instructions are followed carefully. Immediately following surgery. The gauze pad placed over the surgical area should be kept in place for a half hour. After this time, the gauze pad should be removed and discarded. Vigorous mouth rinsing or touching the wound area following surgery should be avoided. This may initiate bleeding by causing the blood clot that has formed to become dislodged. Take ibuprofen and Tylenol as soon as you begin to feel discomfort. This will usually coincide with the local anesthetic becoming diminished. Restrict your activities on the day of surgery. Place ice packs to the sides of your face where surgery was performed for the first 24 hours following surgery. Bleeding. Some bleeding or redness in the saliva is normal for 24 hours. Excessive bleeding, your mouth fills up rapidly with blood, can be controlled by biting on a gauze pad placed directly on the bleeding wound for 30 minutes. If bleeding continues, please call for further instructions. Swelling and bruising. Swelling and bruising are normal after surgery. Swelling will generally increase after surgery for the first 2 to 3 days and then begin to resolve over the course of a week. Swelling may be reduced by using ice packs in the affected region for 20 minutes on and then 20 minutes off during the first 24 to 48 hours. Keeping your head elevated on an extra pillow when you sleep or lie down can also help to minimize swelling after surgery. In some cases, discoloration of the skin follows swelling. The development of black, blue, green, or yellow discoloration is due to blood spreading beneath the tissues. This is a normal post-operative occurrence, which may occur 2 to 3 days post-surgery. Starting at day 3, moist heat applied to the area may help to speed up removal of discoloration. Diet. Drink plenty of fluids. Avoid hot liquids or food. Do not use straws. The sucking motion can cause more bleeding by dislodging the blood clot. Drink from a glass. You may eat anything soft by chewing away from the surgical sites. High calorie and high protein intake are very important. Nourishment should be taken regularly. You should prevent dehydration by taking fluids regularly. Your food intake will be limited for the first few days. You should compensate for this by increasing your fluid intake. Return to a normal diet as soon as possible, unless otherwise directed. Medications. If you have been placed on antibiotics, take the tablets or liquid as directed. Antibiotics will be given to help prevent infection. Discontinue antibiotic use in the event of a rash or other unfavorable reaction. Typically, antibiotics are prescribed for the night before the surgery, as well as the morning of surgery for you to take with a small sip of water prior to IV sedation. Call the office if you have any questions. You may be prescribed pain medications. Take as soon as you begin to feel discomfort after ibuprofen and Tylenol have been started. This will usually coincide with the local anesthetic becoming diminished. It is recommended that 600 mg of ibuprofen, 3 tablets, and 500 mg of Tylenol, 1 tablet, be taken shortly after surgery before the local anesthesia wears off. These medications are spaced 3 hours apart. For example, at noon ibuprofen is taken. At 3 p.m. Tylenol is taken. At 6 p.m. ibuprofen is taken. At 9 p.m. Tylenol is taken, and so on. For any breakthrough discomfort, if prescribed opioid pain medication, take as directed. Do not take additional Tylenol if taking a narcotic pain medication. Do not exceed 3,200 mg ibuprofen in a 24-hour period, or 4,000 mg acetaminophen in a 24-hour period. Do not take any of the aforementioned medication if you are allergic or have been instructed by your doctor not to take it. If prescribed opioid pain medicine, they will make you groggy and will slow down your reflexes. Do not drive an automobile or work around machinery. Avoid alcoholic beverages. Pain or discomfort following surgery should subside more and more every day. If pain gets worse after the 72-hour mark, it may require attention, and you should call the office. Nausea and vomiting. In the event of nausea and/or vomiting following surgery, do not take anything by mouth for at least an hour, including the prescribed medicine. You should then sip on Coke, tea, or ginger ale. You should sip slowly, over a 15-minute period. When the nausea subsides, you can begin taking solid foods and the prescribed medicine. Zofran will be prescribed for any nausea prior to surgery. Oral hygiene. Good oral hygiene is essential to good healing. No rinsing of any kind should be performed until the day following surgery. Brushing your teeth is okay, just be gentle at the surgical sites. The day after surgery you should begin rinsing at least 3 to 5 times a day, especially after eating, with 10 to 15 milliliters of the prescribed Paradex solution. Do not vigorously swish, let mouthwash sit over the surgical site for 30 seconds, and then let gently drain from the mouth. Do not use an electric toothbrush or water pick over surgical sites. Do not begin mouth rinse until 5 days post-operation if bone grafting was performed. Smokers are advised not to smoke for 1 week post-operation. If the corners of your mouth are stretched, they may dry out and crack. Your lips should be kept moist with an ointment such as Vaseline. Activity. Keep physical activities to a minimum immediately following surgery. If you perform exercise, throbbing or bleeding may occur. If this occurs, you should discontinue exercising. Keep in mind that you are probably not taking normal nourishment. This may weaken you and further limit your ability to exercise. Avoid heavy weightlifting and strenuous physical activity for approximately 1 week. Wearing your prosthesis. Partial dentures, flippers, or full dentures may or may not be used immediately after surgery. Dr. Haghighi and Dr. Rowan will give you individual instructions on a case-by-case basis regarding these, if applicable. Bone grafting. If bone grafting was performed, post-op instructions are almost the same. Do not begin any mouth rinses until 5 days after surgery if you received bone grafting. It is normal to have bone graft particles become dislodged during the healing phase for the first 2 weeks. You may notice small grains of material in your mouth. Do not be alarmed, as it is normal for a small amount of this bone graft to come out. There will also be a membrane placed over the bone graft site. This will be held in place with dissolvable sutures that should fall out in 5 to 7 days. It is not necessary to return to the office for removal of the sutures, as they will gradually fall out on their own. Try to do your best not to explore the area with your tongue, as this may cause premature exposure of the graft and loosening of the sutures. The gum tissue around the bone grafted area should be healed 2 weeks after the surgery, and you may begin to have a soft diet on that side of your mouth after bone grafting placement. If you have any questions, problems, or concerns, please call our office at 208-344-9115.